COVID-19 patients who are refusing to self-isolate or use state quarantine facilities are proving to be a problem for government. That's according to Deputy Health Minister Joe Phaahla, who was speaking to the National Council of Provinces yesterday. He said that most of the patients refusing to self-isolate were from the Western Cape. Now, earlier we did hear from the Western Cape's Health MEC, Noma French Mbombo. Let's speak to the Deputy Minister. Deputy Minister Joe Phaahla, good evening and thanks for your time tonight.
Good evening, and thank you for having me on your channel. Thank you very much, Cathy.
Let's get straight into it then. How widespread is this problem of people that are refusing to go into quarantine?
Well, it is significant because, the reason why we mentioned the Western Cape is that, as you know, over the last few weeks, Western Cape has accounted for close to 65% of the infection rate, although Gauteng is rising, but Western Cape is still accounting for more than 60%. So the big numbers have been coming out from there. Now, looking at just the average uptake, because just to remind our listeners and viewers that the approach is that if you are tested positive, we have to evaluate whether you can be self-isolated in your home if you've got a separate bedroom and other facilities like bathroom, where if you're not very ill, if you've got mild symptoms or not having much symptoms at all, until we can monitor you to see whether you get sick in your own home. But otherwise, if your home conditions are such that there is not a possibility because of just the facilities in the home, then we have to provide you with a place, even if you are not very sick, where you can be able to be isolated so that you can infect others. So that is the problem, that out of almost on average every 100, that's far, which the experience in the Western Cape has been, out of every 100, only about 15 to 20. In other words, 15 to 20% of people only agree to be isolated in a facility if they don't have the home circumstances to can self-isolate, which is a major problem in terms of curbing the spread of the virus.
Now, of course, you can't force people to go into any of these facilities, and there's a court judgment to that effect. How much of a hurdle does that pose?
Well, the court judgment, if you're referring to the one of the AfriForum, it actually, it doesn't actually say that way, but it then qualifies it by saying, in the case where they have facilities in their homes to can self-isolate, they can't be forced into a government acquired facility. But it qualifies it by saying, in case they do have the facilities in their homes. But there was also a court judgment in Limpopo, which actually confirmed the right of the government to can force somebody into an into an admission into a government-owned facility. So it's not really, I would say, it's not really that we don't have the instruments, because even both court judgments do not preclude that if a person doesn't have the necessary facility, they should not be forced into a public or a government-owned facility, because we also acquired these facilities from private owners like hotels and lodges. In Cape Town itself, we've got a few hotels and lodges. But the problem is, in managing this pandemic, we want to depend largely on public support and public compliance rather than law enforcement. So this is the kind of frustration in terms of, because it's not ideal that people are forced, because then you may drive people underground that they run away from testing. So we rely really on leadership at community level and support from communities and individuals, because it's not ideal to use enforcement measures.
All right. Unfortunately, we're going to have to leave it there, Minister. The connection is simply not playing ball. Deputy Health Minister Joe Phaahla there.